Hey, everybody, welcome to another episode of Something More Fulfilling. Today, we have a really special guest, Mr. John Graham. He's from Australia, so you'll get to hear a very cool accent today. He is the CEO of a company called Lumaflex, which produces red light therapy devices, something that I've been very keen on lately. And I'm super excited to hear his story, his entrepreneurial journey, what makes his company so exciting, and the awards that they've won. So, without further ado, John, welcome.
Thank you. I really appreciate being on your show. It's very much needed to get exposure and access to audiences. So it's that your audience has big trust in you because of the content you put out. So allowing me to get in front of that audience is really appreciated.
Thank you so much. So, John, our podcast really focuses on people that have built empires, built companies along their entrepreneurial journey. They are stressing about trying to balance everything in life and still focusing on the things that truly do matter in life. So, before we get into your current company and all the amazing products you guys are producing, let's take a step back real quick. Tell us about your path into where you are today, like your entrepreneurial journey, how you got started in it. I know that you are an athlete, so I would love to get some background for that. And also that you started some gyms a while back. So tell us how that happened.
Yeah, I think it all started with a young, skinny boy that was very much unconfident, curly hair, very tall, small joints. I wanted to build confidence, and the way to do that I found out was in the gym, working out, training, putting armor on my body, putting muscle on my body to build confidence. I really obviously enjoyed the feedback that the gym gives you. You get very empowered. You have a lot of physical strength, which obviously leads to mental strength. And I wanted to share this out to people because I loved this feeling so much. So I became a trainer in the early days. I started training a lot of clients. I got booked up very easily. I think the thing that really makes trainers successful is their conviction and passion for fitness. If you're very much a fitness person in mind, body, soul, people can see that and they want to be around you because you're sort of the epitome of what they want to be, physically at least. And you can resonate well with what they're looking for. I got very busy being a trainer. I got into golf fitness. I started working with tour players. I would travel around the world with golfers and be with them during tournaments. Then I wanted to impact more people rather than just a one-on-one relationship. I wanted to be able to sort of do more in the world. So I started opening gyms because then you're not just one-on-one, you've got a group, you've got a membership. Then I started training trainers, and those trainers would then train clients, right? So you could kind of see, and you get a lot of validation, because you're really having a very large impact, at least in the community I was in. So I opened around, I think it was 6 gyms in total. The thing about a gym business is it's location fixed, right? You can't really go much further than where you are. You have to bring people to your location in order to be part of their lives or be part of their journey. So I want to scale more. So I got into technology. I got into AI fitness. I'm not sure if you know this brand called Mirror. It's like a mirror interface that reads your body and you work out next to the mirror. It was something that became very big during COVID.
I did see some people having some of those devices. They look pretty cool. So
Yeah,
basically, it's like a big camera, and then it has a big screen, right? So it kind of sees you, and then you see yourself, but also there's a screen up near the top where you can actually have somebody that is kind of going through the movements, and you're kind of mimicking
yeah.
them, right?
The idea is it's like a virtual coach that can see what you're doing. The camera it's reading your movements. So if you are not performing the movements correctly, the camera can read that and can give you real-time feedback. But that was when everything went into lockdown and everyone was sort of exploring digital options and at-home
Hmm.
fitness. That it was quite a big buzzword back in the day. So I was part of a company that was building that, and I was the head trainer. I was the content guy. That was really fun. Learned a lot during that, but we were very short to market, and then COVID ended, and everyone just couldn't wait to get in front of people again, right?
Hmm.
But then I got into blockchain fitness, and right now there's a company, Impact, that I'm still involved with that's working with blockchain, and it's like where you're able, again, using that technology, able to read your movements, but instead of having a large device, you can just use your phone. So that's something very exciting, and I'm happy to still be involved with that. But throughout that whole time doing those businesses, I was very competitive. in sports. And I felt like if I'm in fitness and I want to represent myself well, the best way to do that is to be competitive. I would aspire to be a lot of these pro athletes that also were business professionals in fitness. And it sends the message that I'm practicing what I'm preaching. I'm not just here to take your money, but I'm also looking for challenges. I'm also trying to push myself. The sport that I really got deep into was rugby.
Mm-hmm.
And rugby, as you would imagine, anyone who hasn't played rugby, you can see it's quite a heavy collision sport.
Yes.
You have to be quite a rough boy to play well. And I remember, doing quite well and kind of not being, I wouldn't go as far as to say I was the best on the team, but I was pretty damn close. But all of that ended when we first went on tour as a team, and I blew out my shoulder, just coming into a tackle wrong, just sort of overshooting myself a little bit, getting a bit cocky. And as you know, the universe likes to use those opportunities to remind you who you are, like, yeah, don't get ahead of yourself. But I remember being on tour, and the medics that were there at the tournament, they were like, I don't know what to do here. Like, this is something we don't want to touch. We had to go to a hospital, but I really I wasn't able to see an actual doctor or medical professional for about 4 or 5 hours, which meant that all the ligaments, everything was quite severely damaged. It took quite a few months to get back, but I still wanted to play rugby, and I went to play a few games again. I did quite well, but then I remember the reason I was always nursing that shoulder. I was always, every time I would approach in a tackle, because I was part of the forward packs, all right? So there's a lot of hits that we have to do. I was always cautious of that shoulder, which meant I was overcautious with my other shoulder, which the other shoulder getting fractured as well. So that pretty much was the universe telling me very, very clearly, don't play rugby anymore. You're not built for this. So, as much as it was sort of depressing to do that, I did quickly try to find something else to get involved with. And that was CrossFit at the time, which was becoming very popular. And it was kind of like, because CrossFit is basically gym workouts, but done in sort of a sport format where you have leaderboards, you have competitions, there's regionals, and you progress to different rankings. And then eventually you get to go to the games, right? You get to compete for the title, the fittest on the planet, which I remember being so obsessed with being able to achieve something like that. But it also has it's very high volume, high load. It's very taxing on the body.
Very dynamic,
well
and a lot of Olympic lifts are very injury prone people, right?
Yeah, that's right. Because it's Olympic lifting, it's powerlifting, it's kinesthetics, it's gymnastics. There's a lot of different modalities that are all combined to sort of create that super athlete. I think it was a snatch or a clean and jerk. It was an Olympic move that I did, and I remember I kind of came down on my knee quite hard, my left knee, and it was feeling funny, but I just ignored it. And I think that was obviously the mistake, was just sort of pushing through the pain and ignoring the pain, which then got worse and worse and worse. And it got so bad that even if I was in a seated position with my knee at 45 degrees, it would be in so much pain just sitting down. Even if I had not recently worked out, taken time off, it was just something that I was used to deal with this pain in a seated position. I would carry with me this deep heat cream that you can buy, and I would just rub my knee multiple times throughout the day just to get blood circulating in that area to try to suppress the pain. But it just meant that people were saying that this could potentially get worse and worse. You certainly cannot be doing any competitive CrossFit anymore, and you should be looking at a rehab program, get it checked. But I was just like, no, I'll be fine. I'll be okay. It's just something that I'll heal naturally from. But it obviously that didn't work. But
yeah.
So I stopped doing CrossFit and I went into boxing. Even to this day is still my number one passion. I absolutely love the sport of boxing, and fighting amateurs for a number of years was very, very fulfilling. I would recommend boxing to everyone. If you're looking to make a career out of it, that's kind of a different story. But if you're just sparring and maybe you do 1 or 2 fights, it's a very good sport to get involved with. It's extremely good for your conditioning, for your cardio. I mean, it's very, very, very fun sport too. I enjoy the rivalry, like this mando kind of, where you got another human being in the ring with you and you're just like, okay, who's it going to be, kind of thing. That, for me, that was very fulfilling. I enjoyed that challenge. But after a number of years of boxing, I started to get a lot of headaches quite often. especially in the back of my head. Like it was like someone pushing their finger up through my head.
Mm-hmm.
And I remember a day when I was swimming, I just had a lot of pressure in my head and the pain was quite atrocious. It was something that I couldn't ignore. So I went to hospital to get a full scan and they found a tumor in my head. And the tumor was about the size of my thumb, just about
Mm-hmm.
that. And they said that the reason that this tumor was created was because of micro traumas to the brain. So they were asking me, like, have you been in a car accident? Did you have a serious fall or when you were a kid? And I told them, oh yeah, well, I enjoyed boxing. And they were saying, well, this could be, through, impacts to the
Repeated
front.
hits in the face and
Yeah.
head trauma.
Okay, better not do that anymore. So I no more impact sports, and I had the tumor removed, and I was still sort of thirsting for a challenge, and I got into bodybuilding, which was quite fun. It's very safe. Obviously, it's just basically dieting, and doing curls and just doing the
Sure.
workout. But there's
Yeah.
no real rivalry in that competition. It's more you're standing on stage, and then the judge is comparing you to someone else, and
Mm-hmm.
he says like, this guy's calves are better than yours. And you're like, no, I like my calves. Don't care. Yeah. But it's still something that is easy to get into. And if someone wants a challenge that isn't so aggressive and so heavy on the joints or, prone
Mm-hmm.
to injury, it's
Yeah.
fun to do. But all that to say, throughout those injuries, and especially starting with my knee, I discovered red light therapy. It was actually introduced to me by my wife, who's Chinese. She introduced this. It was a very tall, ugly, it was a gross product. This thing. It was a lamp, and it was something that you would find, in some, villain's lair where Batman comes in and he like stops the villain from doing. It looks like a torture contraption. It was very old technology with a big weighted base that I had to move around the house. But it was the bulb, the red bulb, and I think you can still find these on Amazon. It would get very hot. The bulb would get very hot, and my wife told me, like, put it on your knee for 20 minutes every night before you go to bed. And I was like, okay, this is some feng shui medicine, so it's fine. But after a week, the pain, I didn't feel any pain left, and how I noticed it was in that seated position that I was used to having to always the knee, get some deep heat oil, put it on that. I used to have to always go through this process, and I just didn't need to do that anymore, being in a seated position. So that was, of course, quite interesting. And then after a week, I stopped using it, and I gave it to her grandfather. And at first, I didn't think much of it. It was sort of like, oh, it just must have healed itself. But then as time went on and the pain didn't come back, I was like, that's very strange. I haven't done anything
Different.
I
Yeah.
didn't do anything extraordinary. But then the lamp, I was like, that could be what,
Yeah.
or maybe at least a combination of some of the other things I was doing. I was taking joint supplements like they were candy, like I was, all of the
Like
ones you would get.
glucosamine and chondroitin or
Yeah,
whatever.
all of those. Yeah, creasing a
Mm-hmm.
lot of those. But then getting more curious about light therapy, I deep dive into what it was. It was like a light went off in my head. I was like, this is interesting. And why isn't this used more? Why isn't this talked about more?
What year was this?
This was at least 6 to 7 years ago. Yeah, wow. Time flies, right? Wow. Doesn't seem like that. Right? Yeah, 6 to 7 years ago. But I remember thinking like this should be something that's talked about as much as other sort of remedies for these conditions in the sports and fitness world. Because when it's in the combat world, like I'm very much involved in the combat business. Another business that I do put on fight nights, and I get this guy to fight this guy. You're red corner, you're blue corner. And I got into this from doing boxing myself. And the last fight that I did, I remember looking around and looking at the event, and I said, you know what, I could make this event. The original idea was to build my own event and fight in the event, just so I could get more ring experience. That was the original plan, was I need ring
Mm-hmm.
experience, and it's hard for me to find fights. So I'm going to do my own event, and I'm going to fight in my own event. And then I lost interest in the fighting part, and then I just got into the promotion part. I was like, okay, this can be my thing. I can build fight nights. And this is just a total side hobby that I really enjoy doing. But just being in that fight game and knowing a lot of athletes that are in large organizations, you hear about what people are doing in terms of recovery, treatment, of optimizing their performance and all of this. And red light was barely talked about. And would always wonder, why is it because it's new, or is this, am I on, I remember thinking like, am I on something that's like a gimmick, that's like a, that's, these things come out in fitness every now and then, like
Yes, they
these
do.
fad diets and try this and that. And I remember thinking maybe that's just one of those things, but I had such an amazing response to it. It interested me to sort of explore more and going deeper into it. And fast tracking a little bit of the story, I wanted to create a device that was more suited to me, because that lamp, although it was very helpful, it wasn't something I could throw in my gym bag. It wasn't something that I could tell my friends, buy this lamp. It just didn't have an appeal. The recovery was there, the treatment was there, but the product was the wrong product. So
It didn't fit your lifestyle, right?
yeah, that's right. And I see that even to this day, being heavily involved in photobiomodulation. I know all the companies and the doctors and how we're all part of this community to raise the awareness. I see that the way red light therapy kind of evolved to where it is now is scientists were that devoted their entire lives to light therapy. They were endorsing it, and they were kind of more part of the product development. And that's when devices came out that were not so suited to us as the customer. Whereas now products are being suited. We're not having to suit to the product's being suited to us. So that's where I feel that where we're coming in now is where this natural non-invasive treatment is becoming in devices that are so seamless to use, right? So easy to access. And I think that what I've created, I have it here, the Lumaflex,
Very
is
cool. Yeah.
the world's
Is it battery operated?
battery operated.
Yeah. So you can just basically put that on your arm, shoulder,
Yeah,
chest,
aim at the
wherever.
point.
Is that right?
That's right. Yeah, yeah. There's a 10-minute timer built into the battery. So we have the high, sort of the pro version called the Lumaflex Body Pro. And then we have
Mm-hmm.
the Essential, which I built for retail. Because, being involved in photobiomodulation, and when you're inside, it was still quite relatively new. Now, like even yourself, you're like, yeah, I use red light therapy. We're getting there, right? We're getting that
Mm-hmm.
traction. And this treatment, what we really want to achieve with red and infrared light is for it to be so well respected and used for a range of different human conditions that it is the first thing that you go to as a treatment. Whereas in the US now, I mean, in the US, this is called the standard of care, right? It's where you go into hospitals, I have this issue, this pain, and the doctor has to prescribe this drug to you. And if he doesn't, you can sue him, right? This is the policy. But imagine if
Yeah.
we were at the level where doctors would say, look, okay, before we move to surgery, before we move to medication and get you on a prescription, let's try red light therapy. Give it 2 weeks, or let's give it a month, right? That's
Mm-hmm.
kind of what we're all trying to achieve, is this major change in the medical industry in the US.
Okay. So
That's
jumping on that tangent there, to go back to another point that you made that was pretty interesting, because yes, there are a lot of fads, like you said, a lot of bio things that come and go,
Mhm.
right? That people don't know if it's like, okay, is this really true, or is it just like pseudoscience, right? Because you hear a lot of that stuff and you're like, oh, these magnets, let's go take these magnets. You wear this whole magnet suit, whatever, or magnet mattress. And
Yeah.
so, what is red light therapy? I know that there is a whole lot of research and scientific and peer reviewed studies that talk about the efficacy of red light therapy and near infrared therapy. Can you give us a high level overview of like what are some of the what's actually happening? What
Exactly.
does it actually do for the body, so that people that maybe aren't read in like you and me can know a little bit more about it?
Yeah. So red and infrared light, I always like to explain it as if I'm speaking to my audience, which is the younger John who's in the gym, all about go, 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 go. And he doesn't quite understand about like, let's be smart about our training. Let's also invest in recovery. So I'm always trying to sell that person, right? I'm not trying to
Mm,
sell like a doctor or I'm trying to sell the person that literally is like a fish out of water when it comes to red light therapy. So I mean, in short, red light therapy is from the sun, right? It's natural, meaning it's from the sun. And the optimal time that we can get our red and infrared light is at sunrise and sunset. That's the best time when we can access red and infrared light. Throughout the day, there are other rays of light which are more harmful to our bodies. But if you want red and infrared light as a primal human being, just wake up at sunrise. Here in Miami, I got a beautiful balcony, and this
hmm
morning, sunrise. And that red and infrared light that you get is at the right length to be able to penetrate your skin and activate your mitochondria. You, as a human being, are made up of billions of cells. Inside those cells is like the engine, the driver, the powerhouse, and that's the mitochondria. If you're giving energy to the mitochondria, the cell is able to do what it's supposed to do. So anytime you hear about light, it's about cells. It fixes all these conditions at a cellular level, right? So if I have a sore shoulder, I've had an injury, and I go for a massage or I treat the problem on a surface level, I may get temporary pain relief or temporary recovery. And it may be one means of treatment in a list of treatments that eventually helps me to recover. But what we focus on in photobiomodulation with red light therapy is attacking the problem on a cellular level.
mm,
The light doesn't heal you. It gives cells energy to heal themselves. So there's
mm,
three mechanisms that occur by giving your cells this light. So increased ATP, increased blood circulation, and anti-inflammation. Everything bad in our bodies is inflammation, right? If you woke up with a headache or cancer, it's inflammation. So you're lowering your body's inflammation by using red light therapy. That's really where I preach the use of red light therapy is for pain management. But through these mechanisms, we get an endless list of outcomes. And that's
the
everything
benefits from it.
from hair growth, testosterone boosting,
Collagen
yeah,
production, right?
collagen production in your skin, or boosting your body's SPF, or and then there's also the side of optimizing your red light therapy intake for overall well-being, for anti-aging, by supplementing properly, by eating healthy
hmm
food, by hydrating, by getting certain minerals. There's also that next level to optimize yourself, because anti-aging is all of the talk now in America, right? Everyone's anti-aging, anti-aging. And a lot of it
Yeah.
is working combinations with red light therapy,
Yeah.
getting the cell and then optimizing what the cell can do.
Yeah. I wanted to make sure that the people really quite understand what you just said, which is really, really key here. So when you do massage, when you do basically physical manipulation of the muscles and the joints and the tendons, you're physically just maneuvering it around, maybe helping it relax a little bit more, getting the lactic acid out of it, which is in effect, feels amazing. And it does help recovery. But when you are doing red light therapy and near infrared therapy, you actually are affecting at the cellular level where you are, you know, helping and enhancing the cellular
Function.
capabilities of each of the cells to be able to better fix itself, right?
That's
Which
exactly right.
has more long term effect. But there are a lot of research studies that talk about how there are, like you said, a long laundry list of benefits from using daily red light therapy, from, like you said, recovery and things like that, to collagen production, anti-aging, hair loss. They've kind of been treating that with that, which is
Yeah, yeah.
absolutely crazy. And I know that when you go to spa places, they actually have those masks that you put on your face to, and they charge you 10, 20, $30 for 5-10 minutes of that,
That's
which
right.
you can buy a mask for $100 and do it like every day for 5 minutes, and
That's right.
it's absolutely insane. So let me ask you this. I know that as we all age, and I'm an athlete as well, I play competitive sports for a long, long time, and I still do. I remember the moment where, when the injury happened, you're like, I'm not invincible anymore.
That's right.
When was it for you that you said, you know what, in order for me to focus on performing better, I actually have to focus on the recovery side of things too? Because I think when you're young, you feel like you can just work your way through the tiredness, the pain, the soreness, the aches and pains, whatever. When you get older, you're like, I probably should work smarter than harder to try to make
Exactly.
my body better. Like, what was it for you in that moment? Like, what
Yeah.
did you realize?
Yeah, that's exactly how it was in my personal story. Like dealing with all of these injuries, getting older, and obviously my wife also, when you have a wife, when you have a life partner, usually they do put things into perspective for you, because when
Yes,
you're
you do.
single, you're trying to take over the world all by yourself. But then when you're when you have a unity with someone, you realize like, oh, it's not all about me. It's about us. And there's that yin and yang, like yeah, I very much believe in that this balance. And I would have to say that my wife did balance me a lot and get me. As you get older, then there's a family coming. You need to change your whole mindset, being more cautious, because you not only want to last until your family arrives, but you also want to start and building those skills and strategies to be able to impart that to your kids. I don't want
Mm-hmm.
my kids to do a lot of the things that I did. I want to be able to inform them that, look, based on what I've done in my past, I would advise this. And that's what we do as men. We want to learn how to be better men as we get older. And just like you said, that phrase, work smarter, not harder. And I remember being young so many times. All my friends would tell me this phrase: John, you need to work smarter, not harder. Because I was known for that guy that would, because in Chinese, the Chinese zodiac, I'm a Niu, is a cow. It's an ox. And they're known for just putting their heads down and working, working, working. And
Mm-hmm.
having that, reflecting on that in my younger years as a competitor, and then gravitating more to, yeah, I compete, like competing in bodybuilding, being older, you kind of realize like, winning is a different idea. You don't need to win out there, you need to win in here. You need to win for
Mm.
sort of a higher purpose. And that's the message to share, that I'm really trying to share out to my younger self. And sometimes, that younger self who's very aggressive, you need to give them little bite-sized bits of information. And you may need to like sugarcoat it a little bit by saying you will perform better if you recover. You kind of need to introduce it in a way in which they can accept it. Because as you know, when you're young and you're competitive, you're haughty, and you think you can take over the world, you don't listen to anybody.
Yeah,
Yeah.
yeah, I totally agree. And that was a question I was going to ask you, is because I think it takes the wisdom of age to truly shift your thinking to not, I'm going to be maximizing my performance. And I think you're right. Sometimes you actually do have to put it in a way that they see in the moment, right? Because like you said, there are benefits that are performance benefits, but also longevity benefits for you and me, as we are not at the peak of our primal youth of being the most explosive and the strongest we ever will be at our prime. We're on the downward trajectory in terms of strength. Hey, now I'm not looking to be the, like, winning the Mr. Universe, but like I want to be running and playing with my kids when I'm 55 and not like have blown out knees and can't bend over because I didn't take care of my body. And for me, it's about the longevity. It's about, hey, you know what? I want to be able to play sport competitive, but for as long as possible.
Yes.
Like this red light therapy, as well as, taking care of your body and health wise and things like that. I think that takes on a very different meaning, and not just purely let me run the fastest time or like, beat the baddest dude in the gym, right? It's not about that as much as it is, I want to have a family and I want to be playing basketball with my son or daughter, and not be like, oh, you stop, I just pulled a hip, right? Or, just have your body breaking down quickly, so how do you talk to somebody that, what are the strategies for them to be able to perform even better? Like, what are the highlights of that?
Yeah, it's interesting when it comes to pain management, right? Because I talk a lot about pain management because of my personal story, because of the efficacy of red light therapy for pain. But what research is also showing, clinical studies are also showing, is a significant amount of performance boosting using red light therapy. When tell people to use red light therapy as a pain management solution, I always say, like, try to progress your thinking and your experience of light to where it becomes a vitamin. So think of the Lumaflex as something that you have as like a multivitamin. So if you're feeling like in the morning and not so, or you're feeling depressed or anxious, red light therapy can help. Red light therapy is something that you can always access. When you talk to red light therapy experts and these doctors that have devoted their lives to it, they light therapy above everything else, above clean water daily, healthy food daily, regular exercise, deep sleep. Light is like takes precedence over everything. So I always want to encourage people that it is great for pain, but think of it as a device that is well-being in your pocket. Use it like I put it on my forehead to optimize my brain, just to get my brain functioning in the morning. I put it on my heart, my neck, for my spine. So I always talk about where we're going with red light therapy is, yes, we're going to get a lot of popularity with pain management. All the athletes are going to use it. Then it's going to start being, sort of labeled as the light vitamin. It's like, are you getting your light vitamin? But then even going forward, then that performance boosting. So there was an article, I think it was written 2016 in PubMed. So it's a medical article, and it talks about the unfair advantage of red light therapy in competitive sports, and that changes the whole conversation when it comes to boosting performance. Because there's a lot of talk of using it for these other outcomes, but what's coming in the future is the significant amount of performance, enhancing ability by using red light therapy before you go on a competitive game. So much so, this article is talking about as something that we need to be aware of in the future, just like taking steroids. It's an enhancer. So if you have team A using red light therapy and they're using it on a bed, getting an extreme amount of cellular activity pre-game, and then there's team B, which doesn't use it. The article is basically saying they have an advantage. It isn't fair. Like, sure, there may be that lucky shot in basketball, or there's a lucky kick, or whichever sport, but on a cellular level, they are far ahead. So that really changes the conversation a lot about, about the efficacy of red light therapy of what it can do. It's very easy to find this article, but it's something that you could share out to everyone.
Okay.
But
Yeah,
it's,
that would be amazing to kind of dive deep
yeah,
into that, because I think the conversation is, I think more and more people are being exposed to it. My sister was using a panel for several years, and I was recovering from a shoulder injury, and she said, "Hey, you should definitely consider this. You don't need to go to the doctor yet. Try this," and it was eye-opening for me to think about. And I think it's fantastic, right? You don't have to, you can do it at home. You can do it at the comfort of your home. You can do it as much as you need to, but also that, it's not invasive, right? You're not ingesting anything. You're not having to buy drugs, which I'm not necessarily a big fan of, to fix things, right? Which I think, like you said, in the standard of care here is just like pop a pill. And to me, I'm not about that. So let me ask you this then. What is like 2, 3 things that most people get wrong about red light therapy? What are the like 3 biggest misconceptions?
a misconception is like your first and foremost, what I hear a lot is, like you said, that phrase pseudoscience. People think like, oh, you're those sun worshiping hippies back years ago that were all raving about it. Which, by the way, now all of them, everyone's like, oh my god, I should have listened to you. But they just think that you're like, this is that, those people that do those sun salutations and show their crotch to the sunlight. And of course, those people obviously have their merit. They're a little bit extreme, but I think that's a misconception that people get a lot. It's just that it doesn't work because there's a label with it that was, back in the early days of how by it just simply being packaged wrong. And something that 2 things that are very, very important with red light therapy. specifically with pain management. Okay, so red light therapy, if someone says, I've got, don't have much hair, will red light therapy help? That's down to the company who's selling the red light therapy device for the head, their marketing, the protocol, the supplements you take, all of this, right? But you're obviously not going to see it right away. You're not going to be like, oh my God,
Walk out of the session.
Everything takes a bit of time. But when specifically with pain management, what I always say is, number one, you got to remember that the device needs to touch your skin. Of course, it depends on the device, how close you are to the device, the best you can get. But really where we're seeing dramatic change, and what we want is for people to feel change in a short amount of time as possible. I said, we're trying to get you fixed as quickly as possible. Please put the device on. We don't want the light to escape. Light reflects, right? It ricochets, right? We lose light if we stand far away. They've done studies to show that if you're fresh up against the device, the amount that you get, the amount of treatment you get, but then if you just move an inch away, there's like a significant drop in the treatment. So touching skin is very, very important. So a lot of times people using devices that are far away, or, oh, my back is sore and I went into a sauna, and, it's still where we're going to see where we're going to see treatment, where we're going to see healing is if you aim at the pain and get right up close to it. The second thing is with the consistency, with the length of time. So everybody's different. The greatest human resource that we have is just our differences. I always say, like, everyone being different is a good thing. It just means we have to think everyone's pain is different. Everyone's pain response is different. Everyone's recovery is different. We have to acknowledge that with everyone. Some people may recover very fast. Some people will recover very slow. It all depends on you, your genetics, how you take care of yourself. Are you sedentary? Are you active? Do you hydrate? Do you sleep well? Because your cells, if you're giving your cells energy, the cells, again, could do what they're supposed to do, but maybe they have other things they need to do. There's inflammation in other areas that you're not addressing. If you're lazy, if you smoke, if you drink, you've got like migraines, and then you hurt your knee and you're aiming this on your knee, your cells they're going to prioritize other areas, and they may take a lot of time. Chronic pain is something that I believe most doctors, when they get on stage and talk about the success stories of red light therapy, they talk about sciatica, arthritis, like really long-term chronic pain. And we've seen amazing benefit to that, like complete transformations. But those sorts of pain relief come somewhere between 2 weeks of regular use and 4 weeks of regular use. And for me, the device that I've got for Lumaflex, for 10-minute treatments with a battery timed at 10 minutes, I say aim at the pain, do that 4 times a day. You can space it out. You can do it back to back. It's up to you. It's up to your time, your schedule. Do it 4 times a day. And after 2 weeks, let's have a chat. Most photobiomodulation doctors that I know that recommend red light therapy, they work one month. They say 1 month of continuous use. So then it goes down to like, okay, now we're selling, you're going to have a natural, non-invasive means of treatment. You're going to find relief potentially. Like for me, my knee, it's healed. It's healed. I don't know how any other way to explain it. People say like, oh, do you still need to get red light therapy to that area? And I honestly, I don't remember the last time I put a red light therapy device, even before Lumaflex, on my knee. I don't remember. It's gone. I don't have that problem anymore.
You don't even think about it anymore.
The problem's not there. And I'm not saying everyone will have this. Maybe you will need to maintain. But in order to get that kind of reaction, you have to invest time. So I'm always telling people, please invest time. Please invest time. I know the world is fast. I know we're moving into the digital era. Everyone's fast. But let's just give me a month. Just give me a month.
Yeah.
So it's touch skin, be consistent. And going back to that earlier point about people sort of labeling it as pseudoscience, how this is going to change is when we have people that are very credible, that are very influential, they have the right look, they're endorsing it. Like Andrew Huberman, you wouldn't say he's a mad scientist. Like you have to respect that guy, right? All the study he's done. Another guy that's really famous now is Gary Brecka. He's heavily endorsing it now. And this is a good phase that we're going into, which is really helping to endorse it and kind of, they're packaging it well. They're commercializing it, right? So we're in a good place, and I predict it's going to be shooting.
Okay. Fantastic. Well, John, let's shift gears a little bit here. And I would love to find out more about you as the entrepreneur when you are building a new company like Lumaflex. And you went from a business that is a gym business,
Yeah.
which is a very service based business where you are affecting a lot of people. And now you are a product based business. Okay.
Yes.
What are some of the challenges you have in trying to bring a kind of a medical grade device to market? And what were some of the biggest challenges that you faced? Because that's a whole arena that is fascinating to me.
That's a long question.
Well,
Yeah.
some of the
Well,
big surprises for you, I guess.
so so thankfully, by working with my manufacturer, they greatly support getting FDA. Like that's the manufacturing partner that I chose specifically. That's their big selling point is we can support, because it's an FDA cleared factory, FDA cleared manufacturer. But yeah, where the challenges lie definitely is in prototyping, product development, and the Body Pro, the other device that I left the other one at the office. I'm back at the house now. That one's fully waterproof. So it's
Mm.
battle tested. It's designed for pro athletes, practitioners, exercise therapists. They can use it in their toolkit, when they treat patients. And it's also a potential to be in the military as well. That device, creating a device that's fully waterproof, that's durable, that really can stand the test of time is extremely hard. It's something you can say this is like the world's number one portable red light therapy panel. Going from prototyping, and then you got your manufacturing and orders and managing your costs on production. This is a very big challenge. Then you got launching. Where are you launching? What's your budget for launching? How are you building your team? Hiring, I would say, is probably the biggest challenge, even to date. I think with any company in the world, the hardest thing is to find the right people that know the vision, that are inspired, that want to go for it.
So, what are some of your things you focus on when you are finding that right team member?
Basically, it's you see, there's motivation, there's determination. Motivation gets you up in the morning, but determination is what gets the work done. So you
Okay.
need someone with a combination of these two. You can't be too reliant on motivation. You can't work with people that you have to pump them up all the day, because when
Hmm.
you're away or when there's a bad day, because every day, there's good days.
Yeah, absolutely.
You have to have someone that has a good balance of motivation, but majority is determination. It's something that and determination can go into them just being determined to be part of a big change in the world. Like we're not selling cigarettes here. We're not like selling, we're selling a device that like people have told me. I was on a plane and I met a lady who had, I believe it was her sister, who was suffering from a very serious condition. I introduced her to Lumaflex. We had a great discussion. I think I was flying like from San Fran to Miami. It wasn't a long flight. And then she emailed me later and she said, it was a miracle I met you. When you have these sorts of responses and talks where you introduce something and somebody takes it and then it changes their life, that's what we're all about. And you want to have a team that really gets plugged into that energy. I know you can go and sell property, but I'm not about selling property. We have a vision here. We've got a very strong goal as a company. We're really going to change the world. If we stick to this, there's only good things. We can all sleep well at night and know that we're part of something amazing. And that's what you look for. You look for people that are like, hell yeah, let's go. I want to be part of that, And
Mm.
all the companies that I've built, and well, I guess because I'm such a passion driven person myself, I don't like doing sort of small mundane stuff.
Yeah.
But I just want when you find someone that's like that and you're doing something that is big, it's hard to find those right people. But once you find them, you can go through hell and you can come out, right?
Yeah. Let me ask you this. When you are starting this company and it sounds like you're very much impact driven, passion driven, and I really, really love that. How do you balance trying to build a company? Because I know a lot of founders of companies and it's all hands on deck for quite a while to try
Mm.
to get this thing off the ground. The first year, it's a lot of late nights and a lot of tough conversations, right? When you're
That's right.
like trying to prototype stuff and things don't come from China correctly, and
That's
or
right.
wherever you manufacturing, and how do you try to stay focused on the bigger vision of what you're trying to do, but also not lose sight of the things that are kind of important in your life, like family, the wife, and things like that.
I think if anyone knew the answer to that question, they would be so successful. Like, I
Right.
think it honestly, it's like you just figure it out day to day. There's some days like, and I think it's down to really good communication. Like you have to really communicate not just with others, but with yourself. Because if you're able to do this, it's really a powerful. You can do great things if you're able to do this. There's a lot of stress involved, but if you're conditioned for it, you can turn the stress around, and you can communicate with friends, with family. The worst thing you can do is just not communicate. If you're a good communicator, you can pretty much get through anything, because it's just,
Hmm.
and that's even on the out, the going on the outside as well. That's even with a client, a partner, when you have to explain a mishap or a misunderstanding. If you're a
Hmm.
good communicator, it's all good. I'm not here to burn bridges. I'm here to build them. And that is something that I've found that is greatly helpful, is just being a good communicator, is being just very, like, don't, oh, I'll get to that later. Make sure everyone's informed, get everyone on the same page, and be willing to like take the blame, talk through everything. I think that's definitely a skill set I've got, is the
Okay.
communication.
What do you focus on in the moments where you find yourself, I think you're right. There are seasons in your life where there's times where you're going to be working your butt off and maybe not paying attention to your family relationships as much. And then it swings sometimes the other way. But what happens for you, or how do you bring yourself closer back to center when you do find yourself maybe going off too far and getting into take over the world mode, right? And try to, you know,
Yeah,
build, like, how do you make sure that you bring it back a little bit for you?
yeah. For my own I think that's more just the issue with my own mental brain. How do I balance my own brain? But I still go to the gym. The gym is like my
Monastery,
thinking
huh?
place. Yeah, it's like my little church, and
Mm-hmm.
the whole world can crash down. And a lot of people I see, when the world crashes, they don't go to the gym because it's a physical stress. So you've got stress, and now you're adding physical stress. It's like the stress cup is too full. But for me, somehow, I think it's because I've been an athlete for so long, I can kind of balance myself out in the gym, because the gym is where I win. Do you know what I
Mm.
mean? Like, I've got, sometimes I make mistakes, and all everything's wrong here, but in the gym, on the worst day, I still kill it. Like, I still am the top dog in that area, at least in my head. And I think that's what kind of balances me out, especially community. You got to
Okay.
talk to yourself.
So a lot of our audience and listeners are entrepreneurs, all varying places on their journey. And if you were to give them, say, three pieces of advice about when they are looking to, say, build a company, build a legacy, what would you tell them?
I don't think you should do it unless you have the passion, the conviction. When someone says, I want to build something, that doesn't work. You have to say, I love doing this so much. I think it can be something big. I want to make this big. You know,
Because you're solving a problem in the world, and you're
yeah,
not just saying, I want to have a company.
that's right. Oh, I want to be my own boss. But
Mm.
I really love doing this, and I would love to make it work. And then you become a boss by default. That's kind of how it works. Nobody wants to be a boss. The only reason why you do it is because you wake up every day, not because you're a boss, but because you want to make this thing, you want to change the world. An entrepreneur needs to want to change the world,
Mm.
not to own their own company. It's like, no, no, trust me. If you own your own company, you answer to people.
You
There's still
answer to
people
all your
that,
employees.
yeah,
You
yeah,
actually, you went from one boss to now you have 100
yes,
bosses who you're 100 employees
exactly. Yes. I remember in the gyms that I built, you work for your team. You work for your team. And
and your
yeah,
clients.
we open at 6 o'clock. Guess what? I have to go open the gym at 6 o'clock. It's
Hmm.
like you work harder, you work longer. And one thing is, your brain never turns off. An employee come Friday, 5 o'clock, my bones. It's like, nope, you don't have that luxury. You keep thinking. If you're on holiday, you're taking time off and you're with your loved ones, or you're with, if you run that business, you never stop thinking about that business. And you're just planning Monday. On the weekends, you're just planning Monday.
Yeah. So what's number two? So one, you got to be super passionate and you got to do it for the right reasons. So what is the second one?
Humble.
Okay.
You got to know your lane. Like, you don't step out of your lane. You have to be passionately humble. Don't be proud. It'll bite you in the ass really, really hard. Yeah.
Can you give me an example of what that means for like something tangible?
It's like, if you're good at the front, at going forward, you're not good at the back. What does Alex Hormozy say? I remember he said something in a YouTube video. He said, yeah, there's build, there's lead, and there's sell. Builders, I don't pretend to know everything about the back end. I just need to find someone who is smarter than me in that area. And I will say, you tell me what to do. You're the boss of your department. You tell me what I should do. I'm not going to tell you how to do this. I'm hiring you because I trust you.
Okay.
Someone's being lazy, and that's where you need to push them and you motivation. But definitely be humble in what you know and what you don't. At least that's worth.
Yeah. And what is number three? There's probably a lot of advice you could give if you sat down with you for like 3 hours, but
yeah, you care, but you also have to play with the thinking that you don't care. Because when you don't care, you have no limits. When you care, you're in a sense that you don't want to be cautious. You want to think anything's possible. Does that make sense? Get on the phone with Dwayne Johnson. Let's go. You have to have this, don't worry, I'll figure it out. You have to have this boldness to where you don't care. Because if you're too cautious and too systematic, the energy
you don't take any risk, right?
If you just have to not care. Like, I have sales meetings where I hire salespeople. I say, look, this is what for your sales, we've done the training and everything. I need you to get your feet wet. Go out and just start knocking on doors, calling, emailing. And I don't want you to care if you get responses. I want you to get like a negative response, because you need to get that out of your system. Stop caring. Don't invest so much into a client, into a partnership, into a phone call, into like, oh, this is it. This is the make or break. No, the world's going to keep spinning. And in a year from now, we won't even remember this. Just don't care. Just keep going.
I think some people put too much stake on one response about one customer.
Oh, it didn't come through. And then everyone crashes and it's a failure. It's like, no, I don't care if it's a multi-million-dollar business that we could potentially partner with, or it's like the local, the little local store on the corner. To them, the exact same, because there's nothing like, if just trust your skill that you're doing what you're doing. You're going to learn as we go along. There's no way to get around this, and just not care and just keep moving forward.
I love it.
We miss them this time. We'll get them the next time. Don't worry.
I love that. That's a beautiful piece of advice. What do you want to be known for in 10 years?
I want to be known. I want to be part of the group, the collective, this fellowship of people that are in red light therapy that change the medical system to where it is not just recommended or like introduced, it's prescribed for conditions. That if I was somewhat part of that change, I really would. Yeah, I think
that would actually be really amazing, because there are so many benefits and it's relatively straightforward, right? It's in the direction of, there's always so many good things and not very much, there's not side effects, really. It's right. Amazing. It's one of those beautiful things that you can do relatively easily, non-invasive, not expensive. Once you buy the device, you're just using it, but you don't have to refill it other than charge it.
Yes.
So, Mr. John, thank you so much for your interview today. Thank you for your time, and thank you for sharing with us. Where can they get in touch with you? Where can they pick up one of these awesome devices?
Just go to lumaflex.com. So Luma meaning light, flex as in flexible, because it's a silicone panel, right? It's a mold to joints and muscles. Yeah, lumaflex.com, or hit me up on Instagram at John Graham Fitness. I'm quite active on Instagram because we've got ambassadors that are endorsing us. So it's always great to stay in touch with them. So reach out anytime. Give me the hard questions. Don't make it easy. I'm not good at everything. Like I said, I'd like to be humble. I know my lane, but if I have access to scientists, amazing doctors, photobiomodulation gurus, and I can pretty much direct any kind of question, inquiry, clinical study, condition. Can it do this? So that I can pretty much, answer all of these with the resource I've got.
Thank you so much and have a great day.
You too.